Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Lauren Papanos and Romana Brennan.
Hello, everyone, and welcome to Nourish MD. I'm one of your hosts, Lauren Papanos, joined by my co-host, Romana Brennan today. We have a nutrition-based episode all about oncology and cancer prevention tactics. And so we're going to be discussing a couple of different focuses and considerations throughout the episode. We'll start off just talking about some of the ways that nutritionally we can help support the body in supporting adverse symptoms while going through whether it's chemotherapy or radiation, as many individuals that are undergoing cancer treatment deal with a lot of adverse symptoms like nausea and mouth sores and things of that sort. We'll also talk about some of the nutrition-based interventions. And we just want to caveat this by mentioning that a lot of the recommendations we're going to cover are from an integrative lens. And so there may be some differences in maybe what you've been told from where you're receiving treatment versus some of the things that we're recommending. Well, everything that we are going to recommend is 100% evidence-based from the research. It's always something that, like I said, will come from a more holistic and integrative lens. And so if you ever have any questions about any of these compounds and things, we'd be happy to share with you any of the articles. And you can always run it by any of the doctors and nurses that you're working with in your oncology department as well. And then we'll kind of wrap things up with just talking about some of the supplemental things that you can do, maybe for prevention as well as for post-treatment to help your body with the recovery process after undergoing cancer treatment. So, Romana, let's get into just talking about some of those ways we can support patients with any of the adverse symptoms that they might be experiencing.
Yeah, there really are a wide variety of different adverse symptoms that individuals might be experiencing, of course, dependent upon the treatment method, any kind of treatment approach that they are utilizing, whether that is radiation, whether it is chemotherapy, things of that sort. But we often see a lot of GI issues, and remember that the GI tract goes from the mouth all the way down. So that can also incorporate, like you had mentioned, Lauren, those mouth sores, even taste changes, poor appetite, things of that sort, really dependent upon the cancer type, of course. So head and neck cancer, oftentimes we see more of that kind of throat, maybe digestive issues from more of like a swallowing standpoint, things of that sort. But a lot of the focus of what we might do is really supporting those symptoms, whether that is implementing some texture changes. Maybe it's a matter of changing the temperature of the foods that you're consuming, eating more small, frequent meals if you're noticing poor appetite, getting fuller quicker, not able to get enough nutrition in based on your appetite. Or maybe you're having more of this gastric reflux, heartburn, those types of symptoms. And we need to talk about, okay, maybe we need to make sure that we need to sit upright for at least 2 hours or so after your meals, as opposed to eating, lying down, feeling that reflux happening. Also, weight loss, of course, is a big focus, and any way that we can troubleshoot ensuring that we're having adequate nutrition, adequate protein intake, nutrient intake as a whole. We'll get to protein more later in this conversation. Other symptoms that we might see, especially fatigue too. So other ways that we can support, if we can get outside, get sunlight in your eyes, regulate those circadian rhythms to help from more of a lifestyle standpoint too, of nourishing just those energy levels as a whole. So wide variety of symptoms that individuals might be experiencing, but certainly different ways that we can support that from a variety of different body systems, nutrition, lifestyle factors. Aside from supporting adverse symptoms, Lauren, you had mentioned kind of moving on to nutrition education. And one of the big areas that we really focus on this nutrition education is discussing more of Mediterranean diet approach. Where can we incorporate more of those anti-inflammatory nutrients, antioxidant-rich foods? Those antioxidants that come from foods can be really impactful by helping decrease oxidative stress on the cells that load on the body. So if we can get that through food sources, cruciferous vegetables, which have natural sources of a nutrient called sulforaphane, sulfur-containing vegetables, those dark leafy greens, B vitamins, vitamin C, vitamin E, so many of these wonderful vitamins, minerals, nutrients, those phytochemicals, are in those anti-inflammatory, antioxidant-rich foods. So really any way that we can incorporate those, maybe that's in a smoothie if you can't consume foods or if it's hard to swallow. But really making sure that we're packing the diet with those nutrients to get as much of those cancer-fighting chemicals in there, whether that's from a preventative standpoint, whether that's from a treatment standpoint. So that's kind of the core of what that healthy diet might look like within the context of this oncology nutrition. But there are a lot of then different avenues, different pathways, different dietary nuances that we can go down, which we're going to chat through some of that today. So Lauren, do you mind getting us started and talking through what one of those approaches might be in terms of this nuance to that healthy dietary pattern?
Yeah, so you mentioned about the role of antioxidants. And one of the things that we know about cancer and really all of our chronic diseases is that oxidative stress is one of the leading drivers. And when we talk about oxidative stress, we're really talking about this like pro-inflammatory state where our cells are, not functioning optimally. And one of the ways that we can really support reducing oxidative stress and helping our body reduce that inflammation load is through really trying to create a net positive to where we have more antioxidants than anti-inflammatories, like you mentioned. So that's one really important piece of really cancer prevention of recurrence, and also I would say in the cancer treatment, time frame, maybe after treatment and such. But in addition to this oxidative stress state, we also know that cancer is a metabolic disease. And what we mean by that is that metabolism changes fuel cancer cell growth. So one of that we often talk about is like blood sugar or glucose metabolism, which is essentially the amount of glucose that we're consuming, so the amount of carbohydrate, because all carbohydrates, whether it's a vegetable, it's a fruit, it's a refined sugar source, all break down to sugar at the end of the day, although some are the more nutrient dense than others, right? They all can elevate blood sugar levels. And it's this elevation of this dysregulated blood sugar that can fuel cancer cell growth. And so there's been studies of people that have what we call metabolic syndrome that have shown that both high sucrose, which would be like table sugar, or high fructose, which would be the main sugar that's in fruit, and also in high fructose corn syrup. So we see that a lot in your refined foods. And that's really where we have more of an issue is with the high fructose corn syrup. But that they activate several mechanistic pathways, including inflammation, glucose, and lipid metabolic pathways. And there's this link that we see because of that between an excess of sugar consumption and cancer development and progression that is independent of weight gain. So what that means is that regardless of if you are overweight or if the amount of carbohydrates you're consuming is in a caloric excess to where it's causing weight gain, that just consuming a higher carbohydrate, a higher sugar diet can fuel cancer cell growth. There's a really great book on this that is called The Metabolic Approach to Cancer by Winters and Kelly. Highly recommend checking this out. But I would say that the metabolic way of approaching cancer is definitely kind of a newer concept, but a really powerful one that there is so much success behind because of the underlying metabolic piece to cancer cell development.
Yeah, it's so fascinating. And I think, with a lot of this cancer research, everyone's trying to determine the best way to approach things. So certainly zero harm to lowering the sugar content in your diet. Whether you wanted to go like lower carbohydrate in general is a different story, because there's also evidence to show that lower protein diet and higher fat diet, so kind of modulating those macronutrients in terms of decreasing the protein, increasing the fat content, that can actually also help decrease cancer development too. So the way that this works in the body. So IGF-1, some individuals may have heard of IGF-1, but IGF-1 is a protein that is known to promote cancer development by essentially decreasing the rate that our cells are able to self-destruct, essentially. And that's a very protective factor, very protective mechanism that our cells do by essentially destroying themselves to recycle nutrients, or if they can tell that something's not quite going correctly in the cell programming, the cell can self-destruct in that way. So what IGF-1 can do is actually turn down that self-destruction process, that protective self-destruction process, and stimulate cell proliferation. So proliferating, growing, developing of potential cancer cells, whether they're cancer cells or other cells in general. That's just IGF-1 is this growth factor. It's a growing protein. So studies have shown that there is a positive association between blood levels of IGF-1 and various primary cancers such as breast cancer, colorectal cancer, and prostate cancer. One way that we can decrease levels of IGF-1 in the blood is by restricting protein to decrease that level. And that can be done short term, doesn't necessarily have to be longer term. This lower protein diet can be used more so as a tool and modulated for whatever period of your treatment you are in. So there's IGF-1, and then mTOR is another protein that is also at play in this conversation. So mTOR is a protein that actually controls cellular metabolism, catabolism, which means breakdown, as well as our immune responses, more of that cell destruction, also cell survival, cell proliferation, maintaining homeostasis or that balance within cells. So mTOR as a protein really controls a lot of different processes within each of our cells, which are in all of our different body systems. Our body is made up of tons, whatever, billions, trillions, different cells. But a low protein diet, again, at very specific windows within treatment, for example, based on some research, seeing like before and after chemotherapy, about a week before and after doing a lower protein diet, may actually help eradicate those tumor cells, and doing so by decreasing the activity of mTOR, decreasing circulating IGF-1. So there's a lot of really interesting research in this realm with the lower protein diet. And again, utilizing that during key windows. But that kind of ties us into fasting as well. So Lauren, can you tell us a little bit more about how fasting might be impacting these two different proteins?
Yeah. And one of the ways that fasting helps with cancer, development or preventing cancer cell development is through the impact it has on IGF-1 and mTOR. So I just want to be clear that that's the main mechanism of how this is working. And, it's a bit of a Goldilocks situation, right? Because we need activation of IGF-1 and mTOR to be able to stimulate muscle protein synthesis. So for you to be able to build and retain lean muscle mass. And we don't want you losing a significant amount of lean muscle while you're undergoing cancer treatment, because then that leads to higher risk of sarcopenia and fragility, during treatment and after. But also muscle is so important for also helping improve like glucose metabolism, which we talked about being an important piece of this. So we really want to focus on, like you said, those key windows. And so I really recommend that if you're going to be undergoing cancer treatment, that we're focusing on a higher protein diet and things that are going to stimulate muscle protein synthesis, like strength training and such prior to treatment, and then really seeing this adjustment within the mTOR and IGF-1 more on a just very short time frame, like an acute time period, right? So that you're not getting this chronic depletion to your lean muscle mass. And I think that that's one of the benefits of fasting, is that with whether it's intermittent fasting or what's called the fasting mimicking diet, which we're going to talk about, they're very short-term strategies, right? With intermittent fasting, you're not eating all day long, right? There's just certain periods you're restricting your eating to, so that the body can stimulate a process called autophagy, which is essentially old cell turnover, so that your body's forced to make new, healthier cells. And with the fasting mimicking diet, generally it's a 5-day time period where, yes, you're on a lower protein diet and you're in a caloric deficit to be able to help lower these IGF-1 and mTOR levels, but you're not chronically in a low protein state, right? So fasting in general has been shown to stimulate autophagy, which is that cell death. Intermittent fasting during chemotherapy can be an effective way to actually make chemotherapy more effective. And so some of the research has looked at doing a water only fast 24 hours prior to treatment, prior to chemotherapy, and through the day of chemotherapy, and then breaking that fast after chemotherapy to be able to actually help that chemotherapy be more effective. Not everyone can do this because chemotherapy can make you very nauseous, and you might feel like you need food in your stomach, or you might have a type of cancer, like you mentioned earlier, like head and neck cancer, where we really just need to hold on to every ounce of food that we can get, right? And so it might not be a safe option for you to go that long without any food. But if you're able to do that 24-hour water fast, that can be a really excellent way to be able to get more of the beneficial effects of chemotherapy. Intermittent fasting in general, which would be where you are restricting your time period of eating. So not necessarily a water fast, but where maybe you're only eating, say, like 8 hours out of the day, and then you're fasting completely water only the rest of the hours, has been shown to reduce chemotherapy DNA damage, and also help improve blood sugar regulation, that metabolic piece of cancer, right? And then by way of also improving your glucose levels, so blood sugar levels, your insulin levels, as well as those IGF-1 levels. Fasting mimicking diet is another approach to this that has the same benefits, but just a different way of going about getting these benefits that sometimes is more feasible for people because you're still eating. It's just that you're not eating as much as you normally would. And there is a very strategic way to what you're eating and how you're eating to be able to get these benefits. And so there was a clinical trial that was done back in 2022. They looked at 101 patients, and they found that the fasting mimicking diet was a safe, feasible, and also effective way to be able to reduce blood glucose, that blood sugar level, as well as those IGF-1 levels. And because of these metabolic changes, remember cancer being metabolic, that they had significant anti-cancer effects in these experimental models. And they also found that the fasting mimicking diet helps to be able to activate several anti-tumor immune programs within the body. So again, make sure that we're really using these with the right timing, that you're working with a professional that can help guide you through this. If you have questions about the fasting and mimicking diet, we would be happy to be able to send you more resources and get you set up with that. That's something that we've done programs with at PPMA before, because not only are we talking about it being a potential option during cancer treatment, but it also can be a great preventative option and something that you can do a couple times per year to be able to potentially help with forcing that autophagy and maybe helping with cancer prevention. So let's talk about some supplement considerations. But before we do, I'm going to kick it over to Ramona for a little bit of word from one of our favorite companies.
Yeah, so when it comes to any of our supplement recommendations, Lauren and I always use Fullscript. Fullscript is a third-party supplement dispensary that we use here at PPMA. So any of the supplements that we're going to be chatting about today are always going to be available through our favorite supplement dispensary, which is Fullscript. So we will have information below in the show notes. If you wanted to create an account, if you are a PPMA patient, you can, of course, save 15% off of all of these professional grade supplements. And that also does include free shipping. So we rely on Fullscript often when we do our one-on-one work, group sessions, any of our supplement recommendations, we always go through Fullscript. So great, reliable place to get those high-quality supplements, many of which we will be chatting about today, which first, to kick us off in terms of the supplement conversation, which we've already discussed a little bit in terms of incorporating anti-inflammatory nutrients into the diet, antioxidant-rich nutrients into the diet. But we can also supplement with some of these antioxidants that have specifically shown to have very potent anti-cancer effects. The first one that I had mentioned earlier with those cruciferous vegetables is sulforaphane. So sulforaphane is most potent actually in broccoli sprouts. So you think about how a sprout turns into an actual piece of broccoli, crown of broccoli. When we can eat it in that sprout form, we're just getting all those nutrients in a much more concentrated dose. So whether you want to incorporate broccoli sprouts into your meals, snacks, top it onto a salad, it's really great to incorporate. Also just incorporating cruciferous vegetables to get sulforaphane as well.
in slightly smaller doses. But if we did want to supplement with it, research has been shown that sulforaphane does have a potential role in both cancer prevention as well as cancer treatment, helping to block the activity of some of these compounds that can actually actively mutate the cells and lead to that cancer development. It can also work by inhibiting this uncontrolled cell growth that's characteristic of cancer development, and then also working to stimulate that programmed cell death to help kind of allow the cells to auto-regulate, pulling down the uncontrolled growth of cancer and also increasing the body's natural regulation of what might turn into cancer. Another way that sulforaphane works is also by blocking cancer cells' ability to create new vascular networks, so new capillaries, veins, arteries, things of that sort. If cancer is starved from having that blood source, it can't actually proliferate. So sulforaphane can help by blocking that creation of the vascular network, and then the cancer doesn't have resources and fuel. So another thing to mention, just, again, kind of in the similar vein of with some of these nutrition strategies, we want to use them at particular points. When it comes to antioxidant supplementation, there has been research to show that it might not be appropriate to use this directly around the time that you are getting, for example, chemotherapy treatment, because we do need this kind of pro-oxidative environment in order to target those cancer cells effectively. So we could essentially be preventing the effectiveness of those chemotherapy drugs if we are also taking antioxidants. So important to consider the timing that we might be supplementing with some of this stuff. If you are undergoing treatment, it goes without saying that this is not your personal medical nutrition advice. Please work with someone who knows your situation, who can give you more tailored advice. We're just sharing some strategies, some research in terms of nutrition and supplementation. So have to give that little caveat there.
Oh, I was going to say that I think it's also important to note the preventative effects of the cruciferous vegetables, which are things like broccoli sprouts, cabbage, cauliflower, on hormone-sensitive cancers in particular, right? So some of these like estrogen positive breast cancer and endometrium cancer, ovarian cancer, there has been research to show that they can help with essentially helping our body metabolize estrogen down a safer route, that our body can excrete that estrogen in a more safe way versus when estrogen goes down the abnormal metabolism pathway, that's when free radicals can form and this oxidative stress can be generated. So as it relates to some of these more hormone sensitive cancers, I think these are a huge focus that patients can really highlight within diet and then potentially also supplementation, like you mentioned. But yeah, and then in addition to sulforaphane, lycopene is another one that can be really helpful. And lycopene is what's naturally found in your red vegetables like tomatoes and such. And you might have heard of it before for like eyesight and things. But there's been benefits to show its effect on having anti-cancer activity as well. And through a couple of different mechanisms. One is through helping regulate that oxidative and inflammatory process, that oxidative stress that we're talking about. Also through helping with that cell death or that autophagy that we mentioned earlier. And then third, by actually inhibiting, kind of blocking the ability for those cancer cells to divide and for them to become metastatic. So that can also be a potential option to look at incorporation through diet. And then, as you mentioned, potentially also something supplementally that you can do as well.
Yeah. And on a similar note, any of these kind of food sources, but also teas. So something like green tea has also been shown to have some of those anti-cancer, anti-tumor effects. And that's primarily from the EGCG that is in green tea. So that's one of those specific antioxidants that is present. So again, from a preventative standpoint, as well as from a treatment standpoint, there has also been an inverse association shown between green tea consumption and the development of cancers such as adult leukemia, for example, and a decreased risk of developing that type of cancer. So again, a great one to incorporate on just a daily
basis in terms of incorporating a healing beverage, a antioxidant-rich beverage like green tea, or of course, if we wanted to supplement with something a little bit more potent, there are also green tea extracts that can be supplemented with to provide you an even more potent source of that EGCG, which has been found in some other foods too, such as pomegranate, for example, also has some similar types of antioxidants, but that's the main constituent in green tea in particular. And there's been some pretty robust research about that. So green tea is definitely one of those good ones to incorporate.
Yeah, just make sure that you don't add sugar into it, right? Yeah. And so then the kind of final like antioxidant here, as you can see, antioxidants are really critical for cancer because as we mentioned at the beginning, cancer is formed through oxidative stress, right? And these antioxidants help combat oxidative stress. But it's called glutathione. And you might have heard of this before. Glutathione is primarily made in the liver. It's our body's most abundant antioxidant. So within our cells, we have the absolute most amount of glutathione, especially within our mitochondria. And there's been research to show that low glutathione levels can actually be a driver of cancer because glutathione, because it's something that's naturally in our body, helps our body to be able to regulate these oxidative and inflammatory processes and helps to be able to protect our cells from damage. And glutathione deficiency has been implicated in a lot of different issues, not just cancer, but also like a lot of autoimmune issues, chronic fatigue syndrome, things of that sort, because of its role in helping with cell protection, essentially. And glutathione is just naturally made up of amino acids. So it's a combination of glutamine, cysteine, and glycine. And amino acids are what are naturally found in proteins that we eat. We can eat foods that help our body make more glutathione and help our body recycle glutathione. Anything that is rich in selenium is a really great way to do that. So Brazil nuts would be one of the best selenium options that are out there. Don't need very many, just a few per day as a really great way to help to help support glutathione production and help prevent from this oxidative stress. Those sulfur-rich vegetables, like you mentioned earlier, such as onions, garlic, cruciferous vegetables, are also another great way to support our glutathione levels. And then we can also supplement with things to help with this. You can supplement with liposomal glutathione, or you can supplement with its precursor, which is called N-acetylcysteine. You can supplement with selenium. Alpha-lipoic acid is another supplement that you can use. It's another antioxidant that can help us make more glutathione. So there's a lot of strategies to be able to get glutathione levels up, but we definitely want to make sure that it's something that we have adequate levels of, especially in this prevention of cancer. Now, when we talk about treatment, may not be something that would be safe to use actively during treatment, like you mentioned, Romana, because it is so powerful at helping, decrease this oxidative stress. And we want a little bit of that oxidative stress for the chemotherapy treatment, for example, to be effective. But I highly recommend investigating supplementation of this before and maybe after treatment. Similarly to glutathione, activated charcoal is another really great option that can be utilized maybe in the weeks following being done with treatment, once you're finally done with treatment for both chemotherapy and radiation, as activated charcoal is kind of like nature's sponge that helps to be able to sponge up these like circulating toxins and helps kind of protect these, protect our body from these different toxic substances and pull them out through our GI tract. And it can be good for a lot of different reasons. It can also help with like if you're having any of the residual GI symptoms like loose stools and nausea, there can be some effectiveness of activated charcoal for that as well. However, because it is like a sponge and it binds up bad stuff, it also binds up the good stuff. And that's why we don't want to use it directly around treatment, but would be something that you could potentially consider following once you're concluded with all of your treatment.
Yeah, so lots of information, again, both nutrition and supplement considerations to make sure that those are the right fit for you by working with a professional, working with your care team, whoever is overseeing your care, whether that is an oncology dietitian, your actual oncologist, all important conversations to have because there is a lot of nuance to this. So be sure to work with someone who understands your exact situation. But thank you so much for joining us this month, everyone. We hope that you enjoyed our interview with our doctor last podcast and enjoyed our podcast this month. We will be tackling another topic next month, so be sure to join us. Thanks so much, everyone. Take care.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.